age 25. We will be performing the proper way of assisting the geriatric shower bath. The purposes of bathing: it cleanses the skin of perspiration, dirt, and germs, increases circulation to the skin, and it promotes resident comfort and well-being. Don't forget to gather all of your equipments before you start the procedure, and don't forget to check the doctor's order. Do the hand washing to free hands from contamination before and after the care of each patient. Do the hand gloving to create a barrier and to prevent the spread of microorganisms. Follow the clean to clean technique. You can proceed now to the patient's room. Remember to knock 3 times before entering the patient's room for courtesy. Check if there's a proper lighting and turn off the AC to prevent the patient from chilling while taking a shower. Greet the patient and the representatives, introduce yourself, verify the patient, and explain the procedure. Simply tap the patient's leg if the patient is sleeping. Before checking the vital signs of your patient, sanitize all the equipment before using it to prevent contamination. Vital signs are useful in detecting or monitoring medical problems, and the 4 main vital signs routinely monitored by medical professionals and healthcare providers include the following: body temperature, pulse rate, respiration rate, and the blood pressure. It is important to record the result because it can give the healthcare provider clues about any underlying condition that affect the patient's health and show the patient's progress toward recovery. Offering bedpans or urinals are one of the AM and PM care. Assist the patient when getting out of bed to prevent injury. Carefully remove the IV fluid from the bowl if the patient has IV and assist him in taking a shower if he has a normal body temperature. Assist the patient in entering the shower room, and if he's able, allow him to do the bathing alone for his comfort and privacy. Make sure all the equipments needed are within the patient's grasp. Check the water temperature, and it should be 105 degrees Fahrenheit to 115 degrees Fahrenheit, or allow the patient to test the water by his hand, and provide a rubber mat for patient safety. Provide privacy for the patient, but leave the door a little bit open while he's taking a shower, and remind him to not wet the IV side of his hand to avoid contamination or infection. And then place a sign outside the door that says occupied. Place a chair outside the bathroom and prepare a clean bath towel for the patient to use after taking a shower. Oral hygiene is so important to keep the patient's mouth clean, comfortable, and healthy. Next, let a patient sit on the chair you have provided for him while helping him pat dry using the clean towel and assist him in wearing the gown. Gown the patient by placing the sleeve over the IV fluid container, rehanging the container, and sliding the gown over the tubing and arm with the IV catheter. Position the gown properly on the patient's shoulder. Starting with the IV arm helps manage the tubing effectively and reduces the risk of pulling on the IV line. You can also comb your patient's hair. Please remember to not touch the bed linen with your uniform to avoid contamination. Then, give the patient's medication according to the doctor's order. Shake the bottle well so that the active ingredients are evenly distributed throughout it. To check an IV fluid level, visually inspect the bag's markings for the remaining volume, often by matching the fluid's bottom edge to the scale at eye level. and ask the patient if he needs something more to assist with. Do the aftercare. Gather all the equipments and sanitize them, and dispose the waste materials. Then record and report. And also bring the specimen to the laboratory for examination.
Bloopers nga to.
Oo, parang gano'n.
Sexual harassment yun! Yung asawa ko, nakatingin te! Umayos ka lang! Sige! Natawa!
Ang hirap pigilan! Ang hirap pigilan!
Kung pwede lang, takpan namin yung
Sito mo na!
Parang gano'n malawin mo. Gano'n ka lang, okay? Dapat okay! Wala kang chance!